My name is Dr. Anacleto Melendez. I'm the founder of the Beautiful Heart Foundation and the director for the Center for Holistic, Alternative, and Restorative Medicine, or CHARM. Right now, I have a patient with me. His name is Victor Lane. He has consulted me 2 days ago. His problem, uh, shortness of breath, occasional chest pains, and he's being seen by a regular doctor, and I have with me his medical chart for a second opinion. 2 days ago, have seen him really to be a little bit dyspneic, or with a little bit shortness of breath, and we have reviewed the previous chart that he brought with him that time. Now he's bringing more charts for me to review. But before we go into that, I would like to welcome him first. Good afternoon, sir. Good afternoon.
Thank you. Good afternoon.
The reason we're putting this on video is because you would like to educate the viewing public about the causes of hypertension, heart disease, coronary artery disease, and let them get educated as how to prevent these different disorders. We know that heart disease, with the risk factors of having hypertension, diabetes, can be prevented with a healthy lifestyle. Although we know that these are heredofamilial diseases, but still with a healthy lifestyle, you don't develop these disorders. Now, in your case, sir, you are how old now?
77.
And when did you start feeling kind of discomfort as far as your heart and your lung is concerned?
About a year now.
Oh, so before the last year you were okay. I mean, you had no symptoms at all.
Oh, no symptoms beyond a year.
Oh, more than a year ago. So
Yeah.
pretty much you were having a healthy lifestyle, maybe. Do you smoke?
No, I don't smoke.
Oh, that's a good one. Do you do regular exercise when you were young?
Yes, I did.
And what about your diet?
Oh, the diet?
Is it more of sugar, more of fats?
No, I don't eat that much fat.
So
Very little sugar.
you keep an eye on your diet somehow.
Yes, I do.
But over the years, some people would develop some kind of a coronary artery problems or heart disease, some kind of hypertension. But we'll also look at your family history. How about your parents? Did they have heart disease or hypertension, diabetes?
Yeah, my father had heart disease.
Mm-hmm.
But my mother had cancer.
Okay.
Yeah.
So, but as I've said, heart disease can be heredofamilial, meaning to say it can pass on to family members. Heredo meaning from the genes, familiar because of the lifestyle of the family. Some families can have a very, very poor lifestyle. Yeah. So, in your case, I would presume that you pretty much have a very healthy lifestyle when you were young.
Yes, I did.
That's why I'm not surprised if you are 77.
Yes.
Maybe before 75 you were healthy.
Yeah, pretty healthy.
Pretty healthy. That's the reason why you're kind of worried about your illness, right?
Yes.
And that is also very important. When you develop chest pain, shortness of breath, patients should not take those for granted.
That's right.
Because those are signs of heart disease, pulmonary disease. Okay?
Yeah.
So in your case, apparently, very recently, you were diagnosed with coronary artery disease, hypertension. I think that's pretty much it. The hypertension is a risk factor. We know that for heart disease. That's why we were placed on antihypertensive medications. Now, coronary artery disease means that the blood flow through your arteries in the heart are compromised. We know that we have different arteries in our heart. Now, meaning to say, we call it ischemia, or decreased flow of oxygenated blood in the coronary arteries. So what do? the gold standard is to give you vasodilators. What are those? Would be the Isordeal. Now, other than that, you are also having irregular heart rhythm. You are placed on atenolol, which is a beta blocker. With that, it can also cause the decrease in the blood, in the heart rate. Now, I don't know if your heart rate has been very low, meaning to say below 60. We call it bradycardia, below 60. But last week I saw that you were having slow heart rate, not only slow but irregular rhythm.
Yes.
We call it arrhythmia.
Okay.
Now you said that you were taken off from atenolol. So the recent EKG that I see, and I'm very glad, from below 60, it's already went up to above 60,
Yeah.
which is the normal heart rate between 60 to 100. Below would be bradycardia, below 60, and above 100 would be tachycardia. Now, if you have a very slow heart rate, say below 50, and you develop signs and symptoms of dizziness, headaches, been collapsing, then perhaps pacemaker is the gold standard for treatment.
Oh, yeah.
At this point, I would think you don't need a pacemaker.
Since it's 60.
It's above 60.
Yeah.
And especially that your doctor already have taken out, he has taken out already the atenolol, the beta blocker.
Yeah, because it would be 50.
Your hypertension is controlled pretty much by the medications you've been taking, right?
Right.
Plus, of course, you're given anticoagulants or antiplatelets in the form of your aspirin and your Plavix.
Yes.
Pretty much, you're on the safe side. As long as you take all these medications regularly,
Yes.
you're okay. And of course, with a close follow-up with your physician, and maintaining a healthy lifestyle still, get a little exercise on a daily basis. Keep an eye on your diet, less fats, less sugar. You don't have diabetes, so you're okay.
Well, that's a good thing.
And lastly, looks like you have good experiences with supplements. We encourage all people, especially with poor appetite, to take extra vitamins and minerals and other antioxidants.
Yes.
Are you taking those supplements?
Yes.
Can you mention, or do you have good results with those supplements?
Yeah, I have been.
Is there a special brand for that?
Well, I've been Panoxol.
Panoxol. Okay, so you have here I have no clinical experience with Panoxol at this point, but that's very encouraging to know that another antioxidant, Panoxol, is helping you. What is in Panoxol? It's nothing but L-arginine, L-citrulline, which are kind of amino acids.
That's right.
Yeah, these are like antioxidants, plus red rice yeast, horse chestnuts, cayenne pepper fruit extract, ginkgo biloba, of course, no doubt about ginkgo biloba. So, yeah, I would encourage people, especially those with heart disease, hypertension, maybe cancer, take mega doses of vitamins and minerals and other antioxidants. I have heard stories of terminal cancer, terminal stage of cancer. They improve with mega doses of vitamins, minerals, and other antioxidants, in addition to the chemotherapy, the radiation, and the surgery.
Wow.
See?
That's
So in
awesome.
other words, we're promoting the mainstream medicine, the alternative medicine, even the holistic medicine. The recognition that after all these drugs, after all these vitamins and minerals, we recognize that there is up there, supreme being, that we can rely, can depend through prayers, because we know that He is our greatest physician,
Yeah. The master physician.
our master physician. And we also know that studies have shown, even at Stanford, that patients who are prayerful tend to recover faster than the rest of those patients.
Yeah, that's true.
And also, there are also proofs that healthcare providers who are prayerful tend to be more compassionate, more caring,
Yeah.
and maybe they have special healing hands.
That's true.
So once again, sir, thank you so much for your time.
Yes.
And I hope our short video presentation will educate and, save lives.
Thank God.
Okay, thank you so much.